My name is Tara Hurster. I'm a psychologist and the founder of the Tara Clinic. Now, Tara is an acronym for Therapeutic Addiction Recovery Assistance. So that means that we support successful people and busy people to regain control over substance use and addiction while leaving the guilt and shame behind. Some of the early warning signs for anxiety and stress in both executives as well as workers in health organizations can really be things like irritability, changes in sleep patterns. Perhaps there's a change in the desire for food. So either we want to eat more or perhaps we're not feeling hungry at all. These are some of the symptoms, because the way that the brain works is it switches off the things that we don't need to run away or fight the tiger. So things like sleep and logic and food digestion are some of those things that get switched off. The other symptom that's really common for both leaders and workers in the health industry is actually substance use and other unhelpful behaviours. So things like smoking, alcohol use, drugs, porn, sex, gambling, all of those things are also clear signs of there being potentially an underlying stress, anxiety, depression, or other mental health concern. Some of the techniques that you can use to support yourself with stress, anxiety, and other big feelings is actually going back to the way that the brain functions. So thinking about if we're fighting a tiger or we're running away from a tiger, both of those situations is moving our body really intensely for a brief period of time and then relaxing because we're safe. So that's exercise. By moving your body in a safe and comfortable way, yet doing that regularly, that helps to manage all the chemicals that are released in our brain. The second really great self-help management tool for anxiety and stress is actually mindfulness. And the reason that we love mindfulness is because where exercise uses your body to cool down the mind, mindfulness actually uses your mind to cool down the body. When you are coming at stress or anxiety from both using the exercise and the mindfulness, you're coming at the problem from two sides. My advice to people when they ask me, when should I actually be seeking professional support for these things? My answer is usually, if you're asking the question, then probably now. We don't have to wait until we've hit some kind of rock bottom or we're feeling like we just can't handle it anymore in order to seek out assistance. I strongly recommend that we take a proactive approach to our mental health and our well-being support. So some of the things that you can do is access the mental health care plan through your GP. What that means is that Medicare will provide a specific number of psychology sessions as part of the mental health care plan. When you see a psychologist, they may be bulk billing, which means that you don't have to pay anything, or perhaps they might have a gap fee. So that means that the Medicare rebate will go directly back into your account and you'll only be paying that gap fee. When we think about seeing a psychologist, we're really looking at counseling sessions. So that's individual counseling, which is either provided both face-to-face or through telehealth. However, now we actually have multiple options to provide support for people who are looking for assistance, whether it's stress, anxiety, addiction, whatever it may be. So you've got the option of doing an inpatient stay. That might be through a private hospital where you can go and that is managed through your private health insurance. The second is doing outpatient treatment. And so outpatient treatment may be online. It may be face-to-face. However, what you're doing is you're doing a program that provides you with assistance around a specific targeted issue that you've come with through the professional framework. And thirdly, you can do things in a self-help format. So that might be purchasing an online program or perhaps doing some reading in different books or journal articles. There are lots of different ways that you can access professional support in a way that suits you. Some of the concerns that I've seen as a health professional in the health industry have actually come off the back of COVID and now the impending financial concerns with what's happening in the world at the moment. And some of those concerns are really linked to the increase in how much is being expected of the people who are working, whether that be frontline workers or leadership in health industries. These sorts of pressures may not necessarily have been felt to this extent in our lifetime. However, now we're being expected to kind of go back to normal without necessarily having dealt with the intensity that had come during that period. So what I'm seeing as a result of that is that there's this real increase in anxiety, stress, depression, addiction concerns. All these things are very present because when we think about managing stress and distress, especially in big situations like during COVID, we do the things that we are most well practiced at. And so if the thing that we're most well practiced at is saying yes when really we should be saying no, or having a drink because we're feeling really stressed, then that means that during that time, these unhelpful behaviors actually increased. And the problem with behaviors and habits is when we have a new baseline, that tends to be what kind of persists. So a lot of people are really starting to seek out more assistance now because they're noticing that these things haven't necessarily dropped off now that we've gone back to normal. So it is a concern, and I really encourage leadership as well as frontline workers to access the support that they need in the area that they're really needing that assistance with.